My name is Dr. Chukura. I am a board-certified foot and ankle surgeon with the American Board of Foot and Ankle Surgeons. And here at the Foot and Ankle Clinic of Albuquerque, the most common type of foot and ankle presentation that we see is heel pain. Heel pain is a type of biomechanical fault. And what I mean by that is it is abnormality within the way we walk. We call that gait. So it is caused by gait abnormalities. And these gait abnormalities typically will result in stress or strain to the soft tissue structures. These are tendons, ligaments, muscles around the heel bone. This is a model. This is a foot and ankle model. And this is the heel bone. These are the toes. This is a heel bone. We call this bone the calcaneus. And so stress and strain to the soft tissue structures around the heel bone can often result in pain. Now, the most common type of heel pain that any foot and ankle specialist will see is plantar fasciitis. This is basically inflammation of the plantar fascia, which is a ligament that goes on the bottom of the foot. Again, here's our model and the heel bone. The plantar fascia is a ligament that goes from the heel bone to the toes. And so plantar fasciitis will typically happen in and around this area in the arch or the ball of the foot, essentially the extent of the plantar fascia. Now, the most common place where people will experience plantar fasciitis is right here, where it attaches to the heel bone. Now, I've had people oftentimes when they call to make an appointment, they'll say, I have heel spur. Well, heel spur is actually not the primary cause of plantar fasciitis. See, the heel spur is really an enlargement of where the plantar fascia attaches to. See, the plantar fascia attaches to this area, and like having a coat hanger, you have to have that hook in order to hang it on the rail. You have to have a hook for the plantar fascia to attach to. You have to have a hook for anything to attach to the bone. And this part of the bone, which we call the tuberosity, is where the ligament attaches to. Now, the heel spur is caused by an enlargement of that pre-existing tuberosity or portion of the heel where the ligament, the plantar fascia, attaches to. Now, the cause of the pain, however, is the ligament, the plantar fascia, pulling on this area where it attaches to. You get tension, stress, and strain that causes this ligament to be constantly under tension, resulting in inflammation and thereby pain. And so the heel spur is really not the primary cause of the pain. It just happens to be incidental. Now, the heel spur can cause pain. Yes, it can cause pain in the heel, but that is if the heel spur is growing up in this direction, downward, and you're walking on the heel spur, or the heel spur fractures in and of itself. But by and large, plantar fasciitis is caused by inflammation of the ligament itself. Now, let's assume you think you have plantar fasciitis. Let's say you wake up in the morning and you get pain that makes it hard for you to walk, or you rest for a little while and you get pain in the heel area, which I've just shown you, which, by the way, these are the classic signs of plantar fasciitis. We call it post-static dyskinesia, where you rested for a while, maybe you've gone to sleep, and you wake up in the morning, you have pain in the bottom of the heel that makes it hard to walk, or pain in the arch that makes it hard to walk. That is plantar fasciitis. Let's assume now you've identified that you have plantar fasciitis. What do you do? Well, one of the things I tell my patients is you want to address the inflammation. So one of the things you could do is you could get a bottle of water, you can freeze it up, and now you can roll your foot on that bottle of water. And what that can do is it'll ice the area, give you relief in that inflammation, thereby pain relief. You can also take anti-inflammatory medications. Those work really well to address the inflammation. The other thing you can do is stretch. There are lots of stretching videos on the internet about plantar fasciitis that you can download, you can watch, and you can do those. One of the most common ones is a runner stretch. That really does help. Physical therapy can also help. Now, let's say you tried all of these. You tried activity modification, you tried the stretching, you tried the over-the-counter medications, Aleve, ibuprofen, Motrin, and none of these have helped. What do you do? Well, this is probably the time to seek out your foot and ankle specialist, a podiatrist. And if you go to see a podiatrist or any foot and ankle specialist, one of the first things that they may do after going through a list of the things you've done, one of the things that they would do is perform a cortisone injection. Now, cortisone is an anti-inflammatory, and it will definitely help to address the pain you're having in the heel. And oftentimes, it'll be given right where the pain is. Again, as I mentioned, this is the most common place where people will get pain, and it'll be given right through here. Now, oftentimes, most foot and ankle specialists will perform the injection once, twice, 3 times. I personally go 1 or 2, and if there's no relief, then we look to other options. So now you've tried stretching, icing, sugar modifications, activity modifications. You've also tried the over-the-counter anti-inflammatories. You've tried cortisone. And by the way, one of the other things I would recommend for my patients is inserts. These are orthotics. So these orthotics or inserts, we recommend you put in the shoe, and this gives support for the plantar fascia. And it'll take the strain off of the plantar fascia. So imagine this. Let's say this is your foot. You can see that this will give you support for the plantar fascia and take the strain off of the heel bone, thereby eliminating the need for inflammatory buildup, inflammation to the area. So you've tried all of these things and your pain still continues. What do you do then? Well, one of the things that I recommend that works very well is something that does not require needling, doesn't require surgery, no sticks, really no pain, and that's laser. Laser is an FDA-approved modality for managing pain, specifically pain in the foot and ankle. And so what it does is it will, again, decrease inflammation and give you pain relief, which is what you're seeking. It does a few other things, which we won't get into in this video, but that is it. Laser therapy, class 4 laser to be exact. The other thing that can be done in the foot and ankle specialist's office is ultrasound-based shockwave therapy. Now, I know the name sounds really scary. There's no electrocution, I promise you. In fact, what it does is it utilizes sound wave to jumpstart the cells in this area to facilitate healing, to cause healing, to increase blood flow to the area of the plantar fascia and give you some pain relief. Now, you've tried this and it doesn't work. There are other options. Stem cell therapy is another thing that can be done. Again, the idea is to facilitate healing and regeneration of the injured tissue. And then lastly, surgery. Surgery is reserved for when all else has failed. And again, there's no guarantee with any of these. In fact, the laser and the shockwave therapy I talked about are 85% effective. That's pretty damn good. Now, most people, I would say up to 90% will do well with stretching, icing, shoe gear modifications, cortisone injection, over-the-counter medications, physical therapy. And 90% of people, up to 90% will do well with that. The remaining 10% that don't improve, I typically would do laser therapy, shockwave therapy, stem cell, and or surgery. So my treatment protocol for plantar fasciitis here in the office is to exhaust all non-surgical options before trying surgery. So I would recommend all the things I talked about, stretching, icing, shoe gear, and all those things. By the time most patients see me, they would have tried all of those. So when they see me, I am typically, for that first visit, to give them immediate pain relief, I'm doing cortisone injection. Those I would do once or twice, and most patients do very well after that, and sometimes I don't see them back again, or I see them back but for treatment of other presentations. If they don't do well, then I'm really instituting laser therapy or ultrasound-based therapy, which works about 85% of the time for that subset of 10% that don't do well with the other modalities. 10% of those will usually do very well, to the point where I rarely ever rely on surgical treatment for management of plantar fasciitis. I rarely ever utilize surgical treatment for the management of plantar fasciitis. Most of the time I'm able to do this and treat them well without needling, without an injection, because you know it, most people are scared of injections. In fact, I've had people who've come to see me in the office, and when I talk about cortisone, I have lost them. And so oftentimes I'm recommending those other options, laser therapy and shockwave therapy. And then if all else fails, which sometimes happens, then surgical treatment is instituted, and patients do very well with that. But again, when you institute surgical treatment, the bridge is burned. Sometimes you can go back and re-perform the surgery to release the scar tissue that's built up after surgery. But by and large, that is the protocol for heel pain, or in this case, plantar fasciitis management. which is the most common type of heel pain which most foot and ankle surgeons will see. So again, this is Dr. Chukura with the Foot and Ankle Clinic of Albuquerque. You can check out our heel and foot pain clinic icon on our website. That is onefootandankle.com. That is number one, footandankle.com. On our main page is an icon, heel and foot pain clinic. Click on that and that'll give you a lot of information of all the things we've talked about, including laser and shockwave therapy, as well as stem cell. So in the meantime, be safe.